Welcome back. It's November 17th, and here's Tuesday's Daily Takes Newsburst, sponsored by Edge Messaging. Today, the Wisconsin Department of Health Services reported the deadliest data of the COVID-19 pandemic. The 92 deaths reported is a new one-day high for the pandemic. There are now 2,277 patients hospitalized with COVID-19 in the state, also a new one-day high. The alternative care facility currently is home to 23 recovering patients. The death toll now stands at 2,741, with 694 deaths coming in November so far. This afternoon, Governor Tony Evers released a copy of the COVID-19 legislation he referenced in his statewide address last week. The proposal contains $466 million in spending, which according to the Evers administration, would cover Wisconsin's response to the pandemic until April 1st of next year. Some of the provisions in the draft legislation would prohibit insurers from requiring a prior authorization or quantity limitations on a prescription below 90 days through the end of 2021. Require health plans to provide coverage and prohibit cost sharing for testing, diagnosis, treatment, prescriptions, and vaccines related to COVID-19. Require insurers to reimburse providers for out-of-network care, including telehealth, resulting from COVID-19 disruptions. Allow online notaries through 2021. Prohibit evictions and foreclosures through 2021. Waive interest, penalties or payments on government loans and debt through 2021. Waive student assessment and school report card requirements for 2020 to 2021 school year. Assembly Speaker Robin Vos held a media briefing today on Assembly Republicans' COVID-19 efforts. Speaker Vos said he and his colleagues were developing proposals to address the surge in Wisconsin. He noted that he received Governor Evers' proposed legislation last evening, but was not going to negotiate in the media over the governor's proposal. Rather, Vos said he will consider the administration's ideas and put forward his caucus's ideas. Vos said the Assembly GOP package will include investing in a robust testing system, doubling the number of contact tracers, assisting the healthcare industry, ensuring an efficient distribution of a COVID vaccine, requiring unemployment insurance reform, and helping small businesses. As of press time, there is no official Senate Republican position on possible pandemic-related legislation. Earlier today, Wisconsin Department of Health Services answered questions regarding the preparations Wisconsin is making in advance of the vaccines becoming available, including the process for vaccinators to place orders through the immunization registry, to questions about the timeline for the vaccine availability. Department officials say DHS will still have to maintain high levels of testing and contact tracing through the first 2 quarters of next year until the pandemic slows and enough of the population has been vaccinated. They applauded the fact that a couple of vaccines may be approved in the near future, but it will still be several months before the impact is felt in the state.
This podcast was sponsored by Edge Messaging. For strategic, political communications at the speed of now, turn to Edge Messaging. 262-290-EDGE. That's 262-290-3343. Or visit edgemessaging.com.